Can sex in the water really enhance your pleasure? Or is it more trouble than it's worth? Plus, we'll reveal how you can naturally boost libido, even with diabetes. Next on Sex Talk.
Welcome to Sex Talk, where we answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Leah Janine, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me today is Sex Talk correspondent Derek Latta.
Good to see you again, Dr. Leah.
Absolutely, good seeing you as well.
Season 4, look at that, huh?
Absolutely.
Is that cool, right?
Yep.
Awesome. Well, we got a ton of great questions come today, so are you ready?
I am.
You got your brain turned on?
I hope so.
Okay.
Let's go.
There we go. Well, there's a question number 1. Here it is. I'm less sensitive and it's harder to get aroused. What can I do?
Let's focus on low arousal because that could help with the sensitivity. Try focusing on clitoral stimulation. Many women need this to orgasm, and if you're not getting enough clitoral stimulation, it can lead to a decreased interest in sex. Also, look into using a lubricant. When you're not aroused, you're probably drier, and this leads to pain. While vaginal dryness is more common after menopause, anyone can experience it.
Dr. Leah, speaking of lubrication, and some of the other episodes you've kind of like told us what are good ones, natural ones. Can you elaborate a little bit? Let's say what is a good natural lubrication?
Well, I think the best natural lubrication is coconut oil. It's cheap. And there are properties that make it antifungal, so help prevent against yeast infections, antibacterial. You just got to warm it up a little bit first so it's not clumpy. But coconut oil, great to cook with, great for your hair, great as a lubricant.
Right, and it tastes good too.
Dr.
Leah, what else works?
Well, make sure you're adding enough foreplay. For women, this can be essential to feeling aroused. And don't overlook exploring your own body. Try exploring some of your sexual interests and be sure to talk to your partner so that you can explore new things.
I was thinking, what about medications?
There are medications aimed at increasing your libido, but some say that other solutions can be just as good. If you find yourself with vaginal dryness, hormone therapy might be something that you want to consider.
Dr. Leah, this viewer is a female. Could we give tips, for example, to the males? And I can say this because obviously I'm a man. A lot of us don't exactly know what the clitoris is. Can you maybe help
Well, I think
out?
that people know where it is, but they're mistaken. So it's at the top of the vulva, and it's the part that's exposed is a small portion, but it really looks rather interesting with almost like 2 arms and 2 legs, if you will, but it extends upwards. So it's what people mistake as the G-spot, really, but it's not just the small external part at the top of the vulva, but that is the part that a man may see or might be able to find.
That's a great explanation on that. I appreciate it. A lot of women are going to be very thankful to you, and men too, by the way. Do you have any other tips, by the way?
Well, talk to your partner about sex, especially outside of the bedroom. You could explore each other's interests and it could build sexual tension for when you do get into the bedroom. And going back to exploring yourself, masturbating could help. It's possible that doing it before sex will keep you aroused. Plus, it also helps you explore what you like and what can lead you to an increased sex drive. Other solutions could be trying sex toys, switching birth controls, or doing something as simple as good exercise and diet.
Diet and exercise for better health. Sex,
Yeah.
That's awesome.
New information there.
Okay, when should you talk to a doctor?
Talk to your doctor if you think arousal issues are due to a new medication that you're taking or if you've got other symptoms. If there are sudden changes that you're experiencing, a doctor can also help.
Great. Thank you, Dr. Leah. Our next question. I started taking testosterone to increase my sex drive, and now I have acne. Why did this happen, and what can I do?
Testosterone is an androgen, and androgens increase sebum production, which is an oily, waxy substance that comes from your sebaceous glands. And if the body produces too much of this, these glands can get irritated and clogged. Back acne can also come from hormone changes. This is why teenagers might face these issues.
And you're trying to explain that to a teenager, they'll probably just roll their eyes at you like, what can I do?
I don't know. I think it depends on how bad you're plagued with it. I had a bad bout of acne, so I would have done anything to change that.
Exactly, like egg whites and all kinds of different things, I'm sure. Dr. Leah, what can you do to treat testosterone-related acne?
Well, there are many different over-the-counter treatment options like ointments and creams. There are some things that you can try at home. For example, you can mix 1 part apple cider vinegar with 3 parts water and applying it after you rinse off. You should be using something gentle like a cotton ball. After a few seconds, rinse with water and pat dry. This can be done once or twice a day.
I do apple cider vinegar in the mornings. I drink it.
Apple cider vinegar is wonderful for a bunch of things, although be careful with the enamel because it's so acidic if you're drinking it.
So don't brush your teeth right afterward.
There you go.
So does that work for everyone, by the way?
Well, something like this would be better if you've got mild acne. If you're dealing with a severe case, you probably want to talk to your doctor or head to the pharmacy for some of these other options. I am a big fan of Differin Gel. So like I said, this has been something I've struggled with my entire life, and I'm 42 and still use Differin Gel every day just for acne. But meanwhile, here are some ways that doctors approach the acne treatment.
We see people who had never had problems with acne in their adolescence, but developing it in their 20s and 30s and 40s.
Mayo Clinic dermatologist Dr. Mark Davis says the medical world does not know exactly why adults get acne, but they do know how to treat it.
We use all the same things that you use for adolescent acne. So we use topical treatments and then oral treatments if the topicals don't work by themselves.
Dr. Davis says start with over-the-counter topical products that have benzoyl peroxide in them. Your doctor can also prescribe topical retinoids. If after 3 or 4 months your acne is not improving, the next method of attack is to add on prescription oral contraceptives or antibiotics. If after a couple more months there's still no improvement, there are a number of treatment options, including what's called spironolactone. In very rare cases, your doctor could prescribe isotretinoin, which is very effective, but it comes with side effects such as birth defects. And if you've got a big event coming up and you suddenly get a big pimple, steroid injections can work very well, but they're risky.
Because injecting a steroid can make that area of your skin become what we call atrophic. In other words, you might get a dimple in your skin instead of having the bump on your skin, and that can be permanent.
Dr. Davis also says no matter how clean you keep your skin, acne still happens.
Very difficult to prevent acne.
He suggests using a gentle soap, but when pimples do pop up, most adults can blot out the blemishes within weeks to months when armed with the proper tools of treatment.
Wow, so a lot of what we talked about. Maybe get some guidance on those home remedies and over-the-counter creams and then look at prescriptions?
Yeah, might be worth trying some at first, but you can always connect with your doctor to figure out what works and try to go from there.
Of course. Let's take another question. A viewer wants to know, what are some dangers of sex in the water? Sharks? Or?
Well, I guess it depends on how far out you're going. Didn't even think of that one, but yes, sharks would be another safety concern. Sex in the water might sound exciting, but it does have its own safety concerns. Slipping, drowning, STIs, and UTIs, just to name a few. So it depends on what type of water we're talking about. If it's the pool, be cautious of chlorine because that can make your skin dry and irritated. You can also be extra safe by using some of the pool features like the steps to find the most comfortable positions. And of course, make sure you're sober and you're not using a pool that you're not supposed to be using.
Dr. Leah, I was going to ask you about hot tubs, and I'm sure a lot of people have this in their mind about hot tubs. A lot of activity happens in a hot tub, correct? Is it safe? There might be some fluid things happening in there. Is it hot enough to kill everything?
Well, actually, heat could present a problem. So with hot tub sex, you want to be cautious about overheating and dehydration. Make sure you're hydrating regularly, and don't try this if you're pregnant or if you have any heart conditions.
What are ways to be careful in the bath or in the hot tub or wherever in the pool?
Okay. Well, make sure that if this is the shower or tub, you want to make sure to grab some bars, like hold on to them. If you're in the shower, you probably want some anti-slip mats and avoid anything slippery like oils. To make things more comfortable, consider a double shower head or even one that detaches for extra warmth and adding some additional stimulation.
And Dr. Leah, what about protection in these circumstances? What's the safest situation? And do condoms work? That's the first thing that comes to my mind.
Well, condoms may still be effective in the water, but they are more likely to break, loosen, or slip off, so gotta be careful.
Dr. Leah, our next question. Do gels for erectile dysfunction work better than pills?
There are some different options, so let's go through those. There's something called nitroglycerin gel. This may work faster than a pill, but it doesn't last long, although people who use it feel like it's more powerful and like the fact that it can be applied anywhere where it's needed. There is Med 3000, and research found that 65% of men could get an erection in 10 minutes. Another one is topical sildenafil, or Viagra. However, one study found that only 12.5% of men got an erection when compared to the pill, 70% did. Other gels have promised quick erections, but many experts are skeptical.
And Dr. Leah, what do other studies say about these medications?
Well, there was a Columbia University study that focused on men with ED and low testosterone. It found that men who didn't respond well to Viagra did respond well to Androgel, which is a testosterone gel. They also noted that 1 in 10 men deal with low testosterone when they're between the ages of 40 and 60. This can cause a lot of sexual functioning challenges like erectile dysfunction and low libido. And the way sildenafil works is by increasing the flow to the penis, increasing the body's nitric oxide.
Dr. Lee, that was a serendipitous find. I mean, wasn't this medication originally meant for another type of ailment?
Yeah, blood pressure. So, and sometimes that's just the way it works. I mean, I always joke with a colleague of mine, the best research isn't like, oh yeah, we expected this medicine to help something else. The most exciting research is when you're like, huh, that's weird. How did that happen? And then it just lends itself to further research. So I guarantee they made a lot more money off of what it's used for now.
Right, and they made a lot more people happy as well.
Yeah.
Anyway, our next question, Dr. Leah. I feel sore for days after anal sex. Is this normal, or should I get it checked out, or maybe get a new partner? I just threw that part.
Well, it depends. Some anal injuries can heal on their own, but it really depends on the type of injury. If you're dealing with anal fissures, which is a small tear, laxatives can typically help. If it's hemorrhoids, a high-fiber diet and avoiding straining can help. Surgery may be necessary, but only in severe cases. You also want to make sure that nothing is stuck up there. If so, it should be removed to avoid any complications. Sometimes this might require an ER visit or surgery.
Dr. Leah, hoping it's nothing serious, what other self-care things people can do?
Well, ice can sometimes help with the pain and swelling. Using a cold pack, ice covered, and a towel, or even a bag of peas for 20 minutes might help. Try to protect the area so it doesn't get worse. So I would avoid sex until the pain goes away or until you see your doctor.
Well, I'm not going to follow up on that avoid sex part. Let's go to the next question. Will sex still feel good if I use numbing cream?
Well, let's start with how numbing creams work. Tropical lidocaine is a common one because it's available over the counter. It usually takes about 30 minutes to work, and it lasts an hour after it is removed. The numbing effect occurs on the top layer of the skin, so you should be able to feel other sensations like penetration.
Dr. Leah, how do numbing creams affect your partner?
Well, lidocaine can reduce sensitivity for your partner. Make sure that you're waiting 10 to 15 minutes after spraying lidocaine on your penis before sexual intercourse. And if you're using a liquid or a cream, definitely wash it off before intercourse.
Dr. Lee, our next question. How can I get rid of cold sores fast?
As you know, cold sores or fever blisters are caused by the herpes simplex virus HSV1. While there isn't a cure, there are some ways to get them to heal faster. The first step is acting quickly. If you start to feel one, look into treating it sooner than later.
So Dr. Leah, you start to feel one. What do you do?
Try ice. This can help numb the pain and get the swelling down. You'll want to use a cold pack or wrap the ice in a cloth so that it isn't directly causing your skin any more damage. There are a lot of creams that you can get at the drugstore to help. They can not only reduce the pain, but they can also keep the skin moisturized. With these products, you want to look for ones that have ingredients like benzocaine. If the outbreak is really bad, a doctor can prescribe an antiviral product.
You know, I was just thinking about home remedies because of my mother-in-law. I remember she uses aloe. She has an aloe plant. She cuts it up, and I'm not saying that she had herpes, but that's a home remedy. I remember she used to use to give her.
Yeah, soothing for a lot of things, right? We think of that with the sunburn, so absolutely. Okay. There are quite a few. Like we said, aloe vera can be quite soothing, and there's even some research that it shows it can have antiviral effects. Lemon balm, tea tree oil, and peppermint oil also have been known to help cold sores heal faster. There's even a medical-grade honey from New Zealand that was found to also be effective. You also want to consider vitamin C, E, and B intake. These can help inactivate the virus. Vitamin E is good for healing. You could even get more of these vitamins in foods like broccoli, spinach, fruits, and berries.
Okay, so we know what to do. Is there anything that we need to avoid?
First of all, watch your stress because that can be a common trigger. Other triggers might be the sun, so avoid these situations when you can. And while you might feel the urge to touch or pick at a cold sore, don't. It can spread, so keep your hands away from your face and make sure to wash your hands. You also want to avoid oral sex if you have an outbreak to avoid the spread to your partner.
That's a lot of great advice, especially a lot of people I'm sure have this situation going on. So thank you for your amazing advice, and hopefully it helps a lot of people.
Exactly, and a lot of people who have underlying herpes virus have no symptoms. Here are a few things that you might want to know about cold sores.
Cold sores on the lips can be embarrassing and tough to hide, but turns out you might not have a reason to be embarrassed.
70+% of the U.S. population has been infected with herpes simplex 1. Now, a very small percentage of those people will actually develop cold sores.
Dr. Pratish Tosh, an infectious diseases specialist at Mayo Clinic, says genetics determines whether a person will develop cold sores.
Proportion of the population, they don't quite have the right immunologic genes and things like that, and so they're not able to handle the virus as well as other people in the population.
The problem is people can spread the herpes virus whether they develop cold sores or not. Herpes virus spreads through physical contact like kissing, sharing a toothbrush, even sharing a drinking glass, or through sexual contact.
Since the number of people who are infected but don't have symptoms vastly outnumber the people who are infected and have symptoms, most new transmissions occur from people who have no idea that they're infected.
Dr. Leah, just curious, can someone spread it to themselves? Like that they touch their mouth and touch somewhere else, vice versa?
Actually, yes. I know someone that happened to. She, I guess, touched her mouth. She didn't know it. And then touched her eye. And she actually got herpes of the eye. And it was awful because she was traveling all through Europe. And so I was looking at her photos. I'm like, why do you have an eye patch and like all these pictures? And so she had to keep the eye patch on for the most of her Europe trip. So needless to say, she ruined quite a bit of her pictures that way by really infecting herself. And I also knew someone I used to work with, and she, I guess, had one and went to kiss her husband's knee because it was a sore, and she was just joking around like, oh, let me kiss your boo-boo. And it caused an issue on his knee, which is not something that we think of. So it's all the more reason to be extra careful, especially when it comes to sex. So let's take another viewer question.
That's a great one. Dr. Leah, my libido is low, but I recently found out I have diabetes. Is there anything I can do?
Let's start with managing your diabetes, and that should help improve your sex life. When diabetes isn't managed properly, that can lead to low libido. People with diabetes may also experience high blood sugar, high cholesterol, or high blood pressure, all of which can lead to sexual problems.
Okay, so what are some tips?
Make sure your overall health is good. That means exercising, eating well, reducing stress. You also want to keep your blood sugar under control. It would be good to check your levels right before you have sex. If you're using a lube, swap it out for a sugar-free one. And consider medication. Hormone replacement therapy could help with low libido or dryness. Men might need to look into ED medication.
Sugar-free lubrication. I never even knew they had sugar, some of them.
Sugar-free. Hey, it's less calories, right?
But some
less
have
sticky. Yeah,
sugar?
there's sugar. Oh yeah, a lot of them like
flavors?
Well, the edible lubricants have sugars. So they have a wide variety of flavors of lubricants, and a lot of them have sugar in them. And I actually joked about 20 years ago, like for anybody watching their weight, you need to have sugar-free. And sure enough, the market has it now. So helps for people watching their weight, diabetes, and way less sticky.
Okay, that sounds good. Doctor, do you have any other tips for somebody with diabetes, for example, alcohol? A lot of people,
Yeah.
like their alcohol.
Well, when it comes to drinking, you'll want to drink in moderation and stay away from smoking. Getting good sleep can also be helpful. At the end of the day, you'll want to address any underlying medical conditions. So get your diabetes under control and consider any other conditions that might be affecting you.
Speaking of alcohol, is there a particular alcohol that's lower in glycemic index? Like, for example, I've heard maybe vodka is the...
All those are myths. When you hear all the like vodka versus rum versus whatever, I've actually won numerous bets at bars with people about this. No, so if you're having a liqueur, that has sugar in it, right? And I believe it's over 7 grams per ounce, but I'm not completely sure. So that does have added sugar. So as I always teach people, if the alcohol itself tastes good, your glycemic index is higher, and if it tastes good, you're loading it up with calories, right? Because vodka, gin, none of that stuff tastes good. Margarita tastes good, right? So extra sugar, but all of your liqueurs are just loaded with calories. So not good for anybody trying to watch their weight either.
Got it, okay. You ready for the next question?
Yep.
Okay, here we go. Lately, I don't get as lubricated as I used to. We use a lot of lube, but is there anything else I can do that's more natural?
There are some things to try. Of course, you'll want to stay hydrated. Drink lots of water. Also, make sure your diet is nutrient dense. You'll want to consume vitamins A, B, and E, beta-carotene, and omega-3 fatty acids. Think of foods like eggs, fish, legumes, milk, or simply just take supplements. Herbal remedies may also help, like ginseng, maca, ginkgo, and L-arginine.
You know, you mentioned supplements. I know they're not regulated. You mentioned maca, but is there any other type of supplements that you would recommend?
Yeah. So look for supplements that increase nitric oxide levels. These can improve blood flow and arousal. Zinc could also increase sperm volume.
Is it maca or matcha? Because I know there's two different.
Okay, so matcha is like caffeine, pretty much. Maca, M-A-C-A, is going to be the stimulant that's associated with sex drive, memory, mood, even strength, we've seen in some studies. So M-A-C-A, but not to be confused. People confuse them all the time.
Okay, I know you do a lot of research on that. You've researched maca?
Yeah.
And obviously, what's your opinion? You're saying it works.
Yeah, I saw it worked. We did the only study where people showed improvements in strength in only 28 days, which was pretty impressive. However, you know, we saw differences pre and post test in both men and women, but women were greatly influenced by the placebo effect. So we couldn't say definitively that maca helped with sex drive with women, but we did see that it helped with men. So there's definitely some benefit with men. And you could take it in pill or powder form, and there's a bunch of different kinds, red, black, yellow, all of those things.
Okay, I guess it can't hurt to try it.
Yeah, there really aren't any negative side effects.
Okay,
Nothing
great
major.
tips. Any other tips?
When experiencing dryness, avoid anything that could be irritating, like certain soaps. Water-based lubricants may be good, and applying natural oils could also work. Try something like coconut, almond, or olive oil. They also have a topical hyaluronic acid that could be helpful. There are a lot of reasons why someone would be drier than they want to be, so try to get to the root of the cause.
Try to get to the root of the cause. Okay, what are some examples, for example?
Well, drugs, alcohol, natural hydration levels, stress, diet, age, all of these can be contributors. Even the time of the month can be an issue for some women. Some women may be experiencing low estrogen, and that could affect your body's ability to produce natural lubrication.
You know, they say there's no such thing as a stupid question, but how do you know if your body's making enough lubrication or not enough lubrication? How do you know?
Well, if it's not affecting you, then it's probably fine. But if it is affecting or interfering with your daily activities or your sex life, then it's worth looking into. For example, it shouldn't affect your clothes, requiring you to change often, or prevent you from participating in certain activities. If it does, talk to your doctor. You also want to talk to your doctor if there's any sudden changes in the amount, the color, the odor, the smell.
Are there any medical conditions that would affect this or cause this?
There are a few conditions that would cause someone to create less lubricant. For example, yeast infections, bacterial vaginosis, chemotherapy, depression, and anxiety. Some medications, like allergy meds, can dry you up in just more than one place. So also look into what medications you're taking.
Dr. Leah, last question of the day. The viewer asks, I want to role play, but it's not something my partner is into. Any advice?
Well, it's worth having a conversation with your partner. As always, communication is essential, and it's one way to stay close, especially when you may be on different pages when it comes to sex. Think about something you want to do. What is the appeal? And how can you convey that to your partner? Try to be specific when you can. Explain what type of role play you're looking for, and maybe leave it open to your partner to offer in their own suggestions. You could start with a time, with costumes, or imagining what you and your partner are somewhere else.
I imagine a lot of visual aids will come into, like maybe if you see, like a lot of people have a vision board of their goals in life. Maybe have a vision board of perhaps some role-playing situations.
Of all of your sexual role play.
You know?
I mean, that's one way to approach it. You could have like a calendar with each day.
All right.
This is what I want you to do tonight.
Right. Dr. Leah, is it worth addressing the reservations?
Of course. And as always, it's imperative to get consent. but maybe they're interested and they're just afraid or uncomfortable of trying something new. Maybe they're just embarrassed. All of these are valid feelings, especially during sex. So try shifting the focus away from the insecurities and focus on something you love about your partner. If they look good dressed up, let them know. And that might be all the encouragement that they need.
This is a pretty touchy subject to some people. They might be uncomfortable, and it's hard, no pun intended, it's hard for them to talk about it. Any advice to get the conversation flowing, in a sense?
If you're excited about it, share that excitement. It could be as simple as saying, I can't stop thinking about how hot it would be to whatever you're into, and let them know. Hopefully they will see how happy that makes you feel, and who knows, maybe they'll end up drafting some fantasies of their own.
I guess sometimes it's what's good for the goose is good for the gander, and you have to compromise sometimes in a relationship. So it's healthy to do that.
Yeah, and it's a tricky thing to navigate because obviously you don't want anyone to feel coerced into anything. So you really need to find out if it's something they're just vehemently opposed to or if it's something that they're just shy.
Yeah, perhaps maybe starting slow or something small, or you mentioned earlier communication. That's important. So maybe you can pick up something that they said and, okay, you know what, I'm going to try this. It is not as intimidating, perhaps.
Or especially if there's any role play in like a television show or a movie, that's really easy to be like, hey, you know, whatever it was, Angelina Jolie and Brad Pitt did this, so, you know, maybe it's something we can try. Right. Then that just, it makes it a little bit easier.
Back to the vision board, or put it on your on your Netflix or something. You know?
There you go.
But anyway, but great answers today. Thank you so much.
Well, Derek, this was another great show. I loved answering these viewers' questions. We're out of time, but we'll see you next time on our Sex Talk program when we answer the questions you've always wanted to ask.